Hello, Doctor. I've had a patient brought in today. He's presented at A&E following a fall at home. I've done a physical examination to check for any signs of injury and head trauma. Everything appears to be fine with Peter. He's not complaining of any pain. I have been speaking to his wife, Mrs. Thursby. She's informed me that there's been some confusion recently. She hasn't sought any medical help with that. However, since his fall, the confusion seems to have increased. From a medical perspective, I also feel that due to his confusion, we really should investigate this further, and it wouldn't be safe to send him home at this time. Do you agree?
Yeah, I would agree that Mr. Thursby should be admitted to the ward for further observation. I would like him to be closely monitored overnight to assess the situation and hopefully rule out any head trauma. I would also like to review his medications to see if this could be contributing to the confusion.
Okay.
In the meantime, can we get an urgent CT of his head to be reviewed by a consultant on completion? Can you also obtain a full blood count? Unis, that would be to check his kidney function, as we know impairment may be causing his confusion and restlessness.
Okay.
Could you also make sure that the staff carry out an MMSE to check for signs of dementia as well?
Okay.
Hiya, I'm staff nurse Chloe from A&E. I'm handing over one of my patients, Peter Thursby. He came in through via an ambulance after a fall he had at home, to which his wife found him. The paramedics reported that his observations remained stable.
Okay.
There was no injuries. He had a CT scan of his head, which was NAD. The doctor wants Peter to be admitted because he's concerned about his confusion since his fall, and he's requested to have close observations. As well as an MMSE test to be performed by yourselves when he's on your ward.
Okay.
And also the blood will be updated in time for when he's on your ward, so that can be reviewed. The doctors also said it might be beneficial to do a urine analysis to see if it's a UTI, which can possibly be causing his confusion. But other than that, he's fine, perhaps a little bit unsteady, but that's fine.
Okay.
So if I give you those notes,
Yeah, that's great, thanks.
Yeah.
I'll ensure that his MMSE test is carried out in preparation for the dementia nurse specialist to review him. We'll check that the urine analysis is performed, along with the completion of the ward assessment booklet when he arrives on the ward. Inside that booklet there'll be a 6 CRT cognitive impairment test, which will be able to highlight any specific areas of confusion that Peter may have. Any observations will be carried out throughout the night, along with any neurological observations as requested by the doctor, and I'll ensure that our doctor urgently reviews Mr. Thursby's medication to see if any amendments need to be made. I'll also carry out a moving and handling assessment, any water load score and a risk assessment also.
Okay, brilliant, thank you.
No problem.
Hello, my name is Lauren and I'm a staff nurse looking after Peter Thursby. It's my understanding that you are aware of Mr. Thursby's admission to hospital and his condition. Following my conversation with Mr. and Mrs. Thursby, I feel it would be good if you could have a conversation with them, maybe arrange an assessment and offer them guidance and support on Peter's condition. Mrs. Thursby has been really helpful when doing the assessment of Peter, and it would appear that she has taken quite a caring role at home, and herself is in need of some support on how best to help Peter on a daily basis with his daily life. I've also referred Mr. Thursby to the physiotherapy because due to his mobility and his confidence has decreased as a result of the fall, which is according to Mrs. Thursby.
Okay, I'll ensure that all my assessments are completed as soon as possible in order to prevent a lengthy hospital stay. It is imperative that Peter returns home as promptly as possible, as a prolonged hospital stay may cause his confusion to worsen. However, it is also essential that the correct support needs to be put in place for him and his wife to ensure the best quality of life for them both. Although Mrs. Thursby has taken on a caring role, it is important that Peter does not feel like he is losing his control of his life and his purpose. It is very common for dementia patients to feel like they are losing their independence and their ability to make decisions for themselves. I will also meet with Mrs. Thursby to discuss the skills and techniques that could be adopted to help her stay connected to Peter and to recognise when he is showing signs of fear or distress. I also think that your referral to physiotherapy is a great idea, which will encourage Peter to maintain his independence and build his confidence, whilst also relieving pressure from Mrs. Thursby.
Thank you for that, and that would be a lot of help. Thank you.
Hi, my name is Danny, the physiotherapist that has assessed Peter Thursby in preparation for his discharge.
Hi.
I've worked with Peter a couple of times. To begin with, he did lack confidence with his mobility, but his gait and balance were really good. It was my opinion that Peter would highly benefit from the use of a frame, so we tried that out and Peter did excel with the use of the frame and his confidence did improve.
Okay.
Therefore, I am keen for Peter to go home with a frame. If you could make sure that happens for me, that would be great.
Yep.
I am also aware that Peter has stairs at home, so I've carried out a stair assessment. Peter completed this to a standard that I am happy with, and he carried out a technique which he is able to manage easily. I felt that Peter would benefit from physiotherapy exercises that he can do at home. I outlined these with both Mr. and Mrs. Thursby, and Mrs. Thursby has agreed to encourage Peter with his exercises to ensure that his mobility doesn't decrease any further and also to prevent falls. I feel that it is important for Mrs. Thursby that Peter's mobility doesn't decrease further, as it is often found that carers for people with dementia display poor health due to their caring role.
Okay, yeah, I agree this will be beneficial to both Mr. and Mrs. Thursby, and I'm sure that Peter takes the appropriate Zimmer frame home with him. I've gained information from Mr. Thursby's nursing notes, liaised with the ward nurse, Mr. Thursby and his wife, and I've also liaised with social services about the potential for a care package. I'm aware that Peter is a keen artist and has his own studio containing large sculptures, and worried this could be hazardous for Peter and cause potential fall. I will liaise with social services to pass on required information so visits can be carried out to ensure Peter and his wife are coping at home in a safe environment and no concerns. It is of high importance that Peter is well looked after his discharge, so it is my responsibility to ensure all information is passed on to the appropriate teams. In doing this, it will ensure Peter is discharged at the earliest opportunity and bed space is not taken up when the patient, such as Peter, can be looked after at home in a familiar setting. I have offered advice to Peter's wife and given her a leaflet for Age UK, which she has gladly accepted. Age UK offer a service which provide a volunteer to visit them in the home and participate in activities with Peter. This will help to stimulate Peter and also offer respite for Mrs. Thursby when she needs it.
That's great, thank you.
All right, thank you.
My name is Carly. I am Mr. Thursby's social worker. I have been contacted by the discharge liaison nurse to carry out a care need assessment and a carer's assessment for Mr. Thursby. I have completed an assessment of his need under the Section 9 of the Care Act 2014 in order to have an holistic view of his current situation. I have provided information and practical advice to Mr. Thursby and his wife, who is the main carer to support Mr. Thursby. We will work with Mr. Thursby's wife to provide emotional and psychological support throughout the caring journey of Mr. Thursby, and advise to go to the memory cafe I would like to have some information about his health and about any medication he's taking. This is because I want to complete a care plan so he can leave the hospital safely. I was told that you are already aware of this.
Yeah, I am aware of this. I came up with a few services and holistic assessment that are appropriate and suitable for Mr. Thursby. One of my main concerns is that he's taking over 4 different medications, and this can't be changed till he leaves the hospital. This could be a factor then that could increase his risk of falling. So I will be reviewing his medication and seeing if it's necessary to titrate it. I have also requested a range of blood tests to be completed as from outpatients, as he could be lacking vitamin B, which can also increase his risk of falling. There's also another service called CST, which is available locally for service users who are at risk of falling or had a recent fall. The program provides social skills training that can improve Mr. Thursby's daily routine. They will also show him techniques that will help reduce falls. This service is delivered twice weekly for 7 weeks. Another service that is available is called Sync for the Brain, which is for patients with dementia that helps them with memorizing different needs and stuff.
Oh, I have heard about Think for the Brain, in which most of the patients did actually say that it is very therapeutic. I will incorporate this information to Mr. Thursby's care plan. I may contact you for further information, and we will work together with the multiple disciplinary team to provide an additional support if needed. Feel free to call me or any member of my team if you have any concern about Mr. Thursby's social care need.
Okay then, thank you.
Thank you.